Honored to introduce our speaker Twila Brase, who's going to talk about healthcare and where we go from here. And Twila spoke to us about a year and a half ago, sitting over there. And she's the co-founder and president of the Citizens Council for Healthcare Freedom. And that's a freedom-centric, freedom-oriented, patient-centric national healthcare organization based out of the Twin Cities. People's Healthcare magazine gave Twila quite an honor, is naming her one of the 100 most influential people in the healthcare business. She's been on numerous television networks. She's been on the Today Show, NBC Nightly News, Fox News, CNN. She's been published in the Wall Street Journal, Time Magazine. So she is a very big player in the healthcare industry. And I'd have to say, watching what Twila does here, particularly with the Minnesota legislature, she and her organizations just work tirelessly to help protect us from government intrusion into our healthcare. So please join me in giving Twila Brase a warm round of welcome.
Thank you, Jim. Thank you for inviting me. It's always nice to come down to Rochester and visit with you all and share the latest on what's happening around Minnesota and around the country on healthcare, things that you should know, things that we'd like you to do, things that are not necessarily in the news. So this is kind of an exciting time for you to have your event, because maybe you have been reading the news about a lawsuit, actually 2 lawsuits issued about 2 hours between each other, opposite views on Obamacare, and I'll talk about those in a little bit. But I just want to start off by saying that our organization, yes, is based here, and yes, works at the Minnesota legislature to try and protect your freedoms, to protect your rights, to protect your privacy. But we also work at the national level in trying to help members of Congress understand what we think they need to know about healthcare and to do what we think they need to do about healthcare. So we have a voice both at the national level and here in Minnesota, and occasionally in other states. When other states call us, in particular, they called us about our exchange. Not our exchange, but the fact that our organization created a diagram of what the exchange is. And that had never been done before. And so that's even been on Fox News, and it's been in FreedomWorks and all sorts of places. So what we try to do is just bring healthcare down sort of the size. Because I know sometimes when people talk about healthcare, it's like the eyes glaze over. It's like it's so complicated. Well, the only reason it's complicated is because the government's in it. If the government were not in it, it'd be you, your money, and your doctor. It's not very complicated. That's how you run the rest of your life. And your insurance company would come in there just when you were really, really sick, because you'd have catastrophic coverage. And you'd never pull out that policy. They'd never ask you for your card unless you ended up in the hospital. So healthcare has been complicated by the very fact that government got into it. And now it's just a mess, really. And Obamacare has made it more of a mess. So let me just tell you a little bit, a reminder of when it began, and then tell you sort of where we're at. So Obamacare was passed into law in 2010 and signed on March 23rd of 2010. And there have been lawsuits. There have been the president's own extensions, the president's own delays. There have been rulings out of the regulators that are not in sync with the law. There have been all sorts of ways to try and prevent Obamacare from being felt, the full force of Obamacare from being felt by the American people, particularly until the 2014 election and then until the 2016 election. Some of the employer mandate has been stretched all the way to 2017, because I think the president is hoping that he gets his own party into office as president. So there are also new exceptions that have been added as the administration tries to sort of calm the public and dull the impact of Obamacare. Because if Obamacare came into full force like it was supposed to on January 14th, on January 1st of this year, 2014, there would be all sorts of squealing. And it wouldn't just be Republicans or conservatives. It would be everybody on the street, every employer, everyone who found out exactly what Obamacare has in it. But now the president has delayed it little by little by little in hopes that you're sort of like the frog, you'll gradually get into it, and then another thing will be added. Well, I can handle that, another thing will be added. But I think the full force and effect is planned for January 2017, after the elections. So, but our plan is to repeal the law. So we know we can't repeal the law until after this president is gone, unless Congress would do an amazing thing, turn Republican and all decide to repeal it, send it to his desk, and he was convinced that the country would be lost to the Democrats if he didn't sign it. I have my doubts that will happen. But there was one point within the last year where the Democrats signed on to a bill. And it was actually, I think it was 63% of the Congress was there, including the Democrats. And all they needed was 66% to be veto-proof. So there's always the possibility that that sort of thing can happen, where even the Democrats turn against the president to save their own skins and stay in office. So Obamacare, 4.5 years later, not settled. There's no settledness about it. It's not settled law. It's in the news all the time. I'm sure the president just hates the fact that this is the case. I think that he and the Democrats thought, phew, we got this thing passed, we got it signed, onward. Hasn't happened. It really speaks to the resilience of the American people. It speaks to our hearts and our minds that know that we are meant to be a free people, and that this country protects that, and that Obamacare does completely opposite. The law remains unpopular. The Real Clear Politics poll showed an average of 54.3% of the public. In all the polls that have happened, that was about last week, I think, all the polls for the last 6 weeks averaged at 54.3% opposed to Obamacare. It just is not falling in Obama's favor. So here's a few of the places that we're at currently with the law. There's only 14 state-based exchanges. There's 2 other states that are going that direction, but I think they're reconsidering. And then there's the Washington, D.C. exchange. Here's an interesting little statistic about the Washington, D.C. exchange. Washington, D.C. is a very small little area. The exchange, the funding for the exchange requires money from the enrollees. Well, they cannot get enough enrollees to cover the cost of the exchange. So what is the cost of the exchange? $29 million a year. What is the cost of the Washington, D.C. Insurance Department, which regulates 13,000 health insurance companies? Oh, actually, I should have done this the opposite way around. The health insurance exchange is 10 times higher, the cost per year, than the insurance company. Than the insurance department. So here's this insurance department with 13,000 insurers that they have to regulate, and everything else, and all of the things that come into regulation. And here's this tiny little Washington, D.C. exchange with only 50,000 enrollees and only 4 health insurance companies. But it is 10 times the cost of the department. So it's $29,000 and $29 million, and because they can't get enough money, what are they planning to do? They're planning to assess a charge on every insurance company that operates in Washington, D.C., be it a life insurance, property insurance, every insurance company. And those insurance companies have said, I don't think so. This is an illegal taking under the, I think the 5th Amendment is what they're claiming. So they have sued Washington, D.C. But that's just a little snapshot of the cost of running one of Obama's health insurance exchanges. In Minnesota, they say it's going to be 40 million. In California, it's around 200 million a year. And all of this has to come from money from the enrollees or state taxpayers if they decide that they don't have enough people, which is exactly what Washington, D.C. is moving toward. So here in Minnesota, the Midshore Exchange is in trouble. It's been interesting to listen to the legislative hearings and to listen to their board meetings. Deloitte, who came to save them from their technology, which is not working, essentially got up and testified to the board and said, well, it's not pretty, and you're going to have to prioritize what you actually want to accomplish before the next open enrollment. In other words, it can't all be done. So you can see that at the first enrollment in October, they were nowhere near being close, and they're looked at in the media as one of the exchanges that failed the worst. And yet we have received about $150 million in the state from the federal government to pull that thing together. And now they want $40 million a year to operate it and to continue the money that they need to try and make it work. All of that is coming from taxpayers, whether it's federal or state. The exchange itself, healthcare.gov, you've probably heard about the federal exchange. 30 to 40% of that is not yet complete. Now, you might be interested to know, and this is all part of the lawsuit that came out, that the Obamacare law says that the states shall create state exchanges. But it also has this fallback position for a federal exchange. But how do we know that President Obama had no intention in having to create a healthcare.gov? Because there's absolutely no money in Obamacare to create it. So they have been having to pull funds from all sorts of places to try to do this. And they've been trying to get help from different tech people to try and do this. And 30 to 40% is not done. And what is that 30 to 40%? That is the entire financial accountability of the entire system and the eligibility verification. So just think about that. They can't verify that whoever is enrolling should be enrolling. And they have no accountability for the dollars that are being spent. And so because it's not pulled together, what have they done? They have told the health plan, just tell us what we owe you for these people who are enrolling through the exchange. And once we figure out whether that was the right amount, we'll, even it up somehow. That is how desperate the Obama administration is to get the infrastructure into place and to make sure that Obamacare is embedded into the United States before the next election and then before the next presidential election in hopes that it could never, ever, ever be stricken from our law. So it doesn't matter. It doesn't matter that you can create fraud on it, that you can do fraud on it. It doesn't matter at all. As a matter of fact, the GAO, the Accountability Office in D.C., they put 12 people on trying to get coverage through Obamacare. They gave them false citizenship information and false social security numbers and said, go for it. 11 got in. And nobody has come back to tell them that they're not eligible. So fake everything. And they are now Obamacare enrollees. There are a few other things, such as November 15th of next year is the next open enrollment time. They're all hoping that they'll be ready. I don't think they will be ready, but they will be ready at the federal level to just keep enrolling people no matter what, in order to try to build their numbers. They have said that they have 8 million enrollees. Well, this is the president whose word is really hard to trust. And there is nobody guaranteeing or auditing to make sure they actually have 8 million enrollees. So my guess is they don't have 8 million enrollees. And even if they did have 8 million enrollees, they don't still have them. On May 1st, they said that they issued their last enrollment report to the American public for a long time. And that's when they said they had 8 million enrollees. And we put out a press release in June that got some coverage saying, so where's the next report? And we'll probably put out another one. Where's the next report? Because people are disenrolling. And as a matter of fact, in Colorado, more than 1,000 people have been either kicked out or personally disenrolled because they didn't want to pay the premium or they got another job. But guaranteed that 8 million is not 8 million anymore, if it ever was. So the cost of insurance is increasing, as you know. And you may recall that President Obama said that in his first term, family policies would go down an average of $2,500. But a report came out just this month, earlier this month, saying that actually family costs cumulatively since 2008 when he made that promise, cumulatively they have gone up $18,631 for families. And of course they have never decreased $2,500. So I'll say a few things about the mandates, employer mandates. The employer mandate, some people say it's never going to happen because even the Obama administration is pushing it back. And recently a Democrat senator came out with a letter basically asking the department to move it back another year. The only Democrat who has done that. And so there's already angst within the Democrats about the impact on employers. And one of the things that he says in his letter is that employers have no idea about the extraordinary amount of data that they're going to have to give to the federal government in order to comply with the mandate, and they are not ready. So that is only going to, of course, now here's a revelation. The employer mandate itself, not only just because of the insurance, but because of the paperwork, is going to cost all of us who buy things from employers and businesses more money because they're going to have to get people to do all of that paperwork. But if it doesn't happen, which is what people are now saying, there won't be any employer mandate. It'll either be stripped out, repealed, or the regulations will just never happen until such point that it can be repealed. All of this, of course, is Obama making his own law, deciding that no matter what the law says, he can delay a mandate, he can do this, he can do that, he can tell these people it doesn't apply to them for 6 months. Whatever he chooses to do is what we have been seeing him do. One mandate you may not have heard, or one exemption you may not have heard of, you may have heard that there's 9 exemptions to Obamacare that you can claim. The 9th exemption is called hardship waiver, and the department gets to decide what constitutes a hardship waiver. Well, in a very quiet way, last December, when they announced that if you had employer-sponsored coverage, not employer-sponsored, if you had coverage and you lost it, but you thought that getting new coverage was unaffordable, you were exempt from the mandate. So they did that for those people. But they never announced or talked about exemption 14. So that was exemption, hardship waiver 13, and this is hardship waiver 14. Hardship waiver 14 says you can basically tell the government that it's a hardship in any way you want to say it's a hardship, and they'll say it is a hardship and you won't have to pay the money. They didn't talk about that one, but that we think is because Obama wanted to make sure that everybody was covered by an exemption, but they didn't talk about it, and it took quite a few months before anybody found that. Now on to the lawsuits. So the lawsuits are a really big deal in the news today. On Tuesday in the morning, the D.C. Court of Appeals issued a ruling on Halbig versus Burwell. And Burwell is the new Secretary of Health and Human Services since Sebelius quit. So Halbig is a woman, and there are several other plaintiffs in there, but she just happens to be listed first, so it's Halbig versus Burwell. And the D.C. Court of Appeals said Halbig is correct. The language in the law says that federal subsidies cannot be issued from healthcare.gov, the federal exchange. They can only be issued by state exchanges. And if you recall, I said there's 14 state exchanges in Washington, D.C. 36 states have said no. Here's a really important thing to know about no subsidies in a state. So if healthcare.gov can't issue any subsidies, one, most people won't buy the policies and they will choose to go uninsured, and they will find these exemptions in law and they will claim them. And that means there's no money to keep the exchanges financially sound, but it also means for the state that there's no individual mandate and no employer mandate in any state that doesn't have subsidies. So that is key. No penalties if you don't have subsidies. And that is a reason for a governor and legislators to say, I don't think so. I'm sorry for the people who can't have subsidies, but I'm protecting all the employers, all their employees, and anybody else who buys their own individual policy. I'm protecting them from the government penalizing them for not buying a government-directed policy. So there were 2 hours after that. Oh, by the way, in that particular lawsuit, the judge wrote that he had to abide by the principle of legislative supremacy. And in a beautiful paragraph, which was in our e-news yesterday, for those of you who get our e-news, he talked about the fact that only legislators in Congress can make law and judges can't. And that lawmaking has to be by accountable, or by individuals who can be held accountable to elections, and not by life tenured judges. It was a great paragraph, and it's a very high bar. But 2 hours after that, in a ruling that I think was held until this month, purposefully held until this month, the Virginia Court of Appeals ruled on a similar case, King versus Burwell, and said, oh, I don't think so. The language is ambiguous about state versus federal exchanges and subsidies, and is open to many interpretations, and thus we will look at what the intent of Congress was, and we will say, yes, of course, subsidies can be out of every exchange. So we have these two different opinions, and that means that this is going to end up in the U.S. Supreme Court. It's just a matter of time. President Obama is going to appeal the Halbig decision in order to try and take time, but we think the King plaintiffs are going to appeal directly to the to the Supreme Court. And if the Supreme Court takes it, they will probably scoop in Halbig with it. And then the likelihood is that we'll probably get a ruling by sometime next year. Meanwhile, the Halbig case, the court did not say that the subsidies needed to stop because they expected an appeal, and so the subsidies continue. But what the American public should be thinking now is this actually going to count? Should I trust that I can get coverage? We doubt that there'll be a clawback where they take back the subsidy because it was illegal to be given in the first place. But still, this is something the American people need to think about. Of course, there are other lawsuits in the coming down the pike. There are 2 more that have to do with the subsidies because this is so key to stopping Obamacare. If there are no subsidies in 36 states, the entire Obamacare infrastructure just implodes because it requires people to be enrolled in order to pay for itself. And it is the way the federal government has nationwide or national control over all the states. He's already having trouble because there's only 14 states that said yes. If all that's left is those 14 states, and those 14 states are the ones that get the subsidies but have the mandates, the employers might move from those states and go to the states that don't have the mandate and don't have the subsidies. And so it's big trouble for the Obama administration, the Halbig decision. Now, some people would like to say, what should we do about Obamacare? Should we repeal it? Should we repeal and replace it? Should we tweak it? Should we fix it? I love the mind that it needs to be repealed, a full repeal. This is a law that of 2,700 pages. It has more than 20,000 pages already of regulations to control not only insurance, but doctors and you. It's so intrusive and in so many facets of life that it really has to be repealed. I am concerned about Republicans who say, let's replace it in Congress. And the reason I'm concerned is because there's nothing in the Constitution that says that the Congress should have anything to do with making healthcare policy. The Constitution very much limits the federal government. Where should state policy, where should healthcare policy be made but in the state? So states can, like Massachusetts, create essentially single-payer states, or like Vermont, a single-payer system is what their legislature has said that they will have. That is what states can do, and then individuals can sue them, particularly if the state constitution says you can't do that either. You can't take away my right to have a private health insurance plan. But the federal government should not create another federal system for health care, because the reason that we're in this mess is because they created Medicare. By creating Medicare, there's now 132,000 pages of Medicare regulations. Every doctor is under Medicare. Whatever Medicare says happens to every doctor. Health plans look to the fact that doctors are part of Medicare and therefore under the control of government through Medicare. What we're very happy to see is a lot of physicians who are deciding, percolating kind of around the country, deciding to get out of Medicare and get out of insurance companies. That means that they will take cash, and they will be less expensive, and they will be free from the government constraints. The only thing that could constrain them after that would be if the federal government or Congress or whomever decided to put licensure, base licensure as a physician upon complying with or being part of a Medicare, Medicaid, or any other kind of government program. Massachusetts is already thinking about that. They're already contemplating laws to say if you don't participate in Medicaid, you don't get to be a doctor licensed in this state. That, of course, is serfdom for the physicians. Because they just become a servant of the government. They're no longer a free person. They cannot practice individually. They can't practice on who they want. They can't have a small practice that's only cash only. All of that would be gone. So one of the things about our organization is we're trying to preserve what we call a wedge of freedom in this country. A wedge within the whole system of healthcare, a wedge where doctors can be free and patients can be free to pay cash. Doctors can be free to take cash. Patients can choose if they want to have any kind of doctor, any kind of specialist that they want. And here would be freedom. And eventually we would think that patients, as they got their freedom restricted in the healthcare system, and doctors, as they got their freedom more restricted, would start to look into this wedge and say, here's where I need to go. How can I get into here? How can I loose all the straps that are holding me down? So that's one of the things that we want to do, and one of the ways that we think that we can get there is what we call our 5C solution for healthcare. It is cash for care for minor and routine expenses, which means that no doctor's office should ever have to ask you what's your insurance card before they ask you what your name is when you come in. The next one is catastrophic coverage. We have no problem with insurance, but we think it should be for catastrophes. And by that I mean financial catastrophes. It is there to protect you from losing your shirt when you end up in a coma or a car crash or cancer or some of these really big things. That's what insurance is for. It's for the big things. But we moved to prepaid health care where you hand it over and it pays for everything. That makes it expensive. And that makes it unaffordable for most people. And we need to bring the cost of health care down by moving back to real health insurance, which, by the way, Obamacare forbids. There's another reason why the law has to be repealed. The third one is charity, because we should never be without charity in the healthcare system. And when we lose charity in the healthcare system, we lose charitability. So what has happened with Obamacare? The hospitals that have been providing services charitably are now telling their people, go sign up on Obamacare. You sign up on Obamacare, we can treat you, but we're not providing services for free anymore. Charitability will go out the window when charity goes out the window. Charity goes out the window when the government takes over. The fourth one is confidentiality, because we look at data as he who holds the data makes the rules. If you can keep people out of your data and knowing what your lifestyle is, what your health is, what your major conditions are, what your fears are, all the things that might end up in your medical records. If you can keep them out of that data, they don't know how to influence you. They don't know how to control you. They don't know to say that because your lifestyle is such and so, you can't have this organ when you need it. So if you smoke, you can't have a lung. If you drink, you can't have a liver. If you, whatever. They start building a profile of you. And as a matter of fact, hospitals are now doing exactly that. They're getting data from your credit card companies. They're getting data from social media. They're doing all this because Obamacare says that they need to take care of you not just while you're in the hospital, but when you're outside the hospital, they need to keep you healthy. That's what your hospitals are being graded on. They're becoming something called accountable care organizations, doctors and clinics all wrapped in one big Obamacare ACO. And they are paid according to keeping you healthy, not making you well once you aren't. So this is an important change in healthcare that will lead to more intrusion and more rationing. And that's why we say you have to have confidentiality where your records are your records. You decide who can have them and who can't. You don't just get automatically put on a state health information exchange where the government gets access to all your data. You don't get put in a Minnesota biobank, which is what Minnesota, the Minnesota DFL did here in 2013. They created a biobank for all your health data and all your biological specimens that they might have. That sort of thing should not happen. And then the last C is compassionate care. It's really impossible for nurses and doctors to show you as much compassion and to listen to you as well as they should when they're thinking about the paperwork. So 132,000 pages of Medicare regulations, more than 20,000 pages of Obamacare regulations, penalties for readmitting Medicare patients too soon after they've been discharged, new payment systems where they're only going to be paid for value according to what the government says it is, not for every service that they provide you. Imagine going into your hairstylist and the hairstylist says it's a $50 haircut with the blow style, right, Cosell? And when it's all done, you say, well, you know, I like the haircut. I think that had good value for me. But the hair blowing and the styling, that really didn't. And so I'm going to pay you $35. But that is where we're going in healthcare, where doctors have to report data, the government and health plans decide whether it has value. If it has value, that you get paid for. If it doesn't, you don't. And so these are the many ways that the doctors are being taken under the thumb of the government and of health insurers who are working together like this in Obamacare. Never let any health plan tell you that Obamacare, that they oppose Obamacare. They work with it. They get 98% of all the new spending in Obamacare according to Bloomberg. $1 trillion goes directly to the health plans through the exchanges in expansion of Medicaid and Obamacare. So this is a complicit relationship between the government and the health plans, and they're all working together to control the doctors, to limit your access to care, to move your hospitals further out of your reach. Of course, you're here in Rochester, that's not going to happen to you. However, the plans that you have could send you to Olmsted rather than to Mayo, and you wouldn't have a chance at Mayo. There are these kind of things that can happen. So that's why we have the 5 C's. This is where we think healthcare has to go. We need to get the government out of it. We need to get back to paying cash for most things. We need to get doctors not even concerned about insurance. Insurance should be between you and the insurance company. You deal with it. When the doctor's involved in it, the insurance company can start to take control of your healthcare decisions. And they're then become very interested in who you are, what you do, what you eat, are you exercising. As a matter of fact, yesterday, across my email came a CBO, Congressional Budget Office, score of a brand new bill by Tom Harkin from Iowa, a Democrat. And this bill has a Republican co-author, and it's called the Promoting Physical Exercise for Americans Act. No, Promoting Physical Activity for Americans Act. And in it, the Secretary of Health and Human Services would create guidelines for how we should all exercise. Those guidelines would be specific to things like, but not limited to, age, race, sex, disability, and federal programs who have health care programs, so Obamacare, Medicare, Medicaid, would all be required to promote them within the health care programs. And that is most likely going to be by doing things like you have to pay more, or you won't get this procedure if we don't see evidence that you have been exercising. Wear this Fitbit for a month or for the whole year, and we'll decide. We will watch the data that comes in on how well you exercise and make that a part. This is the kind of intrusion that happens when the government gets involved in healthcare as deeply as it has both. And Medicare started it, then Medicaid, but Obamacare is the big deal where they really, at the end of the day, hope the only place that all of us will be able to get coverage is by going to an exchange. That's the grand plan. Everybody in an exchange, a single seller system that becomes eventually a single payer system. Only one place for you to go, the Minnesota Exchange, the Iowa Exchange, the Wyoming Exchange, whatever, all of it together into a big federal infrastructure, and eventually the government just pays the exchanges a certain amount of money, who pays the doctors a certain amount of money, and then you have a single payer system. So we don't want to go there. It's not our intention as an organization to ever get there, and we are doing everything possible that we can to thwart them, including these little bills like this exercising bill. We've already been talking to the Senate, the U.S. Senate, our contacts in the U.S. Senate about how to stop that bill. So we're actively engaged. And one of the big things that you can do is tell everybody why they should not enroll in MNsure. Tell them not to help the government build a system that's going to ration their care away. Tell them not to have a system where they have no privacy, where they have no control, and where the government decides whether they get health care and whether they're valuable enough for a service that they want or not. So the good news is it's 4.5 years since Obamacare became law. By no means is it settled. It's in the news all the time. And so we expect that we can win. It just may take the next president to get there. Thank you very much.